வந்து 17th Kalpavriksha program conducted by Dr. Agarwal's Eye Hospital and Eye Research Center, which is actually a research wing of and part of Dr. Agarwal's Eye Hospital. 17th, we started in 2007. Kalpavriksha வந்து Hindu scripturesல ஒரு tree இருக்கு. This is called a divine wish fulfilling tree, divine tree ன்னு சொல்லுவாங்க, which is mentioned in the not only in the Hindu scriptures, in the Buddhism and also in Jainism scriptures. இதில் என்ன சொல்லுவாங்கன்னா, இந்த ட்ரீக்கு கீழே நீங்கள் உட்காந்துட்டு என்ன விஷ் பண்ணுறீங்களோ அந்த விஷ் வந்து உங்களுக்கு டெஃபினட்டாக ஃபுல்ஃபில் ஆகும்னு சொல்லுவாங்க. தட் இஸ் வை இட் இஸ் கால்ட் அ விஷ் ஃபுல்ஃபில்லிங் ட்ரீ. ஸோ வாட் டு வி டூ ஹியர்? நம்ம வந்து ஒரு 35 cities இருந்து we gather the students for the CME national CME program. This must be the biggest national CME program conducted in India, which is going on for the last 17 years. So I have experts like Santosh Hanover and the other people who are helping me, Dr. Soundari, Dr. Preethi, Dr. Ramya, Dr. Dhivya, Ashok, and I had lot of speakers all over for morning who are going to give 2 days of their time to this CME program. In the 2 days என்ன பண்ணுவாங்க, experts வந்து lectures கொடுப்பாங்க. So all the students who are wishing to be experts in ophthalmology, they have to be here for 2 days and to learn. So நிறைய வந்து உங்களுக்கு experts வந்து நிறைய சொல்லி கொடுப்பாங்க. புதுசாக இந்த வாட்டி என்ன பண்ணியிருக்கோம், ஒரு வெட் லேப் நம்ம ஆர்கனைஸ் பண்ணியிருக்கோம். வெட் லேப்னா அனிமல் ஐஸ் கொடுத்துட்டு அதில் உங்களுக்கு ப்ராக்டிஸ் பண்ண வைப்பாங்க. டாக்டர் சுமதி ஃப்ரம் போரூர் இஸ் இன் சார்ஜ் ஹியர். இதில் வந்து கேட்ராக்ட் ஆப்ரேஷன் எப்படி பண்ணணும், SICS வந்து SICS கேட்ராக்ட் ஆப்ரேஷன் என்ன, இதில் எப்படி கட் பண்ணிவிட்டு கேட்ராக்ட் எடுக்கலாமான்னு அது சொல்லி கொடுக்குறாங்க இந்த வெட் லேபில். அப்புறமா ஃபேக்கோ எமல்சிஃபிகேஷன், பெரிய கட் போடாமல் சின்ன கட் 2.8 mm போட்டு எப்படி பண்ணுவாங்கன்னு சொல்லி கொடுப்பாங்க. லெக்சர்ஸில் வந்து we have expert lectures like glued IOL, pre-decimal endothelial keratoplasty, oculoplasty, we have oncology, we have so many.
CME of postgraduate, I am invited. Of course, suppose I am postgraduation in something else, of course electricity, and I had the electricity board. And perhaps I think the connection is that both of us look after light. You look after the lives of humans, and I look after the lives of the civilian aspect. Maybe that is the connection. Or the other connection is that I am a patient of Dr. Agarwal's Eye Hospital for 40 years or 25 years. That may be another connection. Or maybe the third connection is that I am a typical, I was running in the third or fourth generation in my family, that all the male folks are engineers and all the female folks are doctors. I don't know. But whatever way it is, I am really privileged to come because Agarwal Eye Hospital I have been visiting year on year for my annual diabetic checkup and eyes because I am wearing glasses for all 40 years. But CME somehow I don't like because I know PG, CME and all. I joke with my wife and daughter, the CME is continuously missing enjoyment, not continuously. Because you really work very hard and all the Latins and all Latin I don't understand, you may understand better. But I just like to say because most of them here I see a lot of women's here and I think ophthalmology, any hospital you go I see lady doctors too many. Maybe you have chosen the work-life balance early in the career that perhaps that is the reason. But I say whatever you do I think for me if I switch off, if there's a problem, I am slightly careless, only the lights of the city will go. But if you are slightly careless I don't have to talk what will happen. So I request you, I just want to talk about this, I don't want to talk about all of you who are expert in doctor, I don't want to talk about ophthalmology. But I think what important in any profession when you are doing with critical problem is your concentration and sincerity. I am not talking about your knowledge. Knowledge anyway, you are ophthalmologist, you are doing PG, so you have been through a grind of multiple needs. And obviously you are best among and you have chosen that facility. But how do you keep mind tension free and stress free? Not a patient, because when you are looking at patients and you are thinking of what is happening at your house, I think things go under it. So I request you, I think you should try out Indian systems of meditation and other things. Especially it's very important for anyone who is doing stressful and continuously working. Because I have seen patient load in Agarwal hospital. I really appreciate the doctors from morning to night continuously flow of patients is that. How do they manage so many patients? One doctor is really surprising, but it's really.
Soundari.
Yeah. No, but I'm saying that good patients in hospitals are always welcome. But the doctor seeing continuously patient, keeping concentration and they're looking at different problem is always tough. So I request you all of this. I don't want to take too much of time. I got delayed because we were meeting our chief secretary on disaster. I hope I don't keep you and so that you are not away from any disease learning which may cause disasters later. But I will request you one thing which is very important in the electricity board. And all of you must be using electricity at home, there is no denying the fact. So if you have any problem in your clinics in any future, you know whom to contact, so you can contact me. But one my request is that I think if you're worried about the electricity bills, please put a solar on your rooftop because that will bring the bills down. These two things, I'll wish you all the best. And I'll say that I think, of course, learning and other things is fine, but work-life balance also is very important. So I think when you are working in the clinic, be totally concentrating on that. After that, forget about it, because it's not only the patient and your technical knowledge when you do a job, in the sense when you're studying, all that matters, but then when you join a hospital or any workplace, the politics matters. It may be between doctors and between your subordinates and other things, and that will cause you much more stress than actually seeing the patient and patient problem. So take care of that. Thank you.